focusing on coronavirus, there's been a surge recently. We're looking at a second wave. Some people are talking about it being the first wave. Andrew Cuomo, the New York governor, looking at how this, he rolls out this.
This, you know what this is? This is the mountain. What is the tallest mountain in the state of New York? Mount Marcy. This is the mountain that New Yorkers climb. You know, I keep showing the curve. This is the curve. It's actually proportionate. We started on day one, and the numbers kept going straight up for 42 days.
When you look at that, you think we're like, what is this, a fifth grade science fair? I mean, come on. This is a giant mountain that somebody took the time to sculpt to make Governor Andrew Cuomo look good. And I mean, before we talk about Cuomo in more detail, I mean, we're talking about there has been obviously numbers of coronavirus cases and deaths are at almost the lowest it's been since March. But there's obviously a couple of things that don't strike me as sound. I mean, they strike me as weird. For one, according to the city, which is the publication, in New York City, Mayor Bill de Blasio's test and trace campaign said they won't be asking anyone who's tested positive for coronavirus if they've recently attended a demonstration. And look, there are certainly a lot of things to worry about coronavirus, considering that New York was the biggest hot spot for coronavirus. And essentially, when we think about how this all got so bad, you have to look at how Governor Cuomo handled it. And he did a really piss poor job in handling it, but was getting fawned over by the media. And now that things are simmering down in New York, he's getting that positive press coverage. And I feel like we can't let it go by and ignore the fact that regardless of how President Trump has handled it throughout the country, certainly within New York, Cuomo had a lot of his own missteps, and that led to a lot of people unnecessarily dying. And it looks like he might get away unscathed with the blood of nearly 6,000 people on his hands. And it all happened from a directive, an executive order that he issued on March 25th, stating that nursing homes, quote, must comply with the expedited receipt of residents, end quote, coming from hospitals, regardless of whether they were infected with coronavirus. The CDC warned that nursing homes need to keep coronavirus out of their facilities unless they were properly able to care for them. And that was a directive that they issued 2 days before. So we're talking March 23rd. March 23rd for the CDC, March 25th for Cuomo. And when he was asked about this, when Cuomo was asked about these nursing home deaths and how things got so bad in nursing homes, who did he blame? Trump, of course. And in a May 20th presser, Cuomo said in response to a reporter's question about his executive order, saying, quote, I'm not going to get into the political back and forth, but anyone who wants to ask, why did the state do that with COVID patients in nursing homes? It's because the state followed President Trump's guidance. So they should ask President Trump, end quote. Now, this is a claim that PolitiFact, who has received a lot of criticism for its left-leaning bias, they deemed this as mostly false. And only a degree further than that would have been pants on fire, basically, straight up lie. But this is I mean, I don't know how you get into the gradients here. It is certain. If it's mostly false, it's still false, and it's in essence Cuomo's lying and trying to save face. The two key factors that the CDC cited to consider whether to discharge patients to a long-term care facility. So we're talking about nursing homes, we're talking about adult care facilities, these extended care facilities. One, that first factor is the patient medically ready for discharge to a long-term care facility? And two, is the selected long-term care facility able to safely care for a patient recovering from the virus by implementing all recommended infection control procedures? Obviously, we have no idea how many nursing homes were able to actually fulfill that order. But after Cuomo rescinded that executive order, basically issuing another executive order saying that, clarifying that May 25th order, basically saying, trying to scrap that whole thing under the rug, saying that, nursing homes can't accept COVID-19 patients. Essentially, Cuomo did this to free up space in the hospitals. And if you recall, the ship, the Comfort, that came up from Norfolk, Virginia, all the way up to New York City, that was used obviously for healthcare and essentially coronavirus when things got really bad. But Cuomo did this to save up hospital space for seriously ill coronavirus patients. And the reality is that nursing homes felt pressured to accept coronavirus patients after Cuomo's March 25th executive order. The AMDA, the Society for Post-Acute and Long-Term Care Medicine, they opposed the order, saying that it was, quote, overreaching, not consistent with science, unenforceable, and beyond all, not in the least consistent with patient safety principles, end quote. According to the Kaiser Family Foundation, long-term care facilities account for this was reported yesterday. According to the Kaiser Family Foundation, coronavirus cases in long-term care facilities accounted for only 14% of all cases. But in long-term care facilities, 45% of the deaths came from coronavirus. That's massively skewed. Think about it, like almost half of the people who died from coronavirus in the entire country, only 14% of the patients were in these long-term care facilities. And nearly half of them, of all deaths of coronavirus in the country, died. 45%. And in light of all this, Andrew Cuomo goes on Chris Cuomo's show, and this is what happens.
Me having you on the show is an unusual thing. We've never really done it, but this was an unusual time, and there were unusual needs, and you stepped up in an unusual way that really was created by a vacuum of power on the federal level. You're not the only one. There were other governors, and you've been very good and collaborative with Hogan down in Maryland and Whitmer and DeWine and the ones up in the Northeast region. But these unusual times have demonstrated some unusual characteristics in people. And of course, I won't always be able to keep having you on the show. It'll never be seen as fair in people's eyes, and we both get that, and that's okay. You got plenty of people to talk to. But I want you to know that, June's a big month for us, right? We got Mom and Pop's anniversary on the 5th. We got Pop's birthday on the 15th. And this is what he always wanted. He was proud when you became governor because of what he knew you'd do. Remember that whole talk he gave us about, I'm not proud, I don't believe in pride, pride's deadly sin, and blah, all that. What he wanted to see is what you'd do with the opportunity. And everything that he ever said mattered to him about public service is what you demonstrated right here and right now during this period when your state needed it most. And I hear it all the time. Not everybody likes you. Not everybody likes me. Everybody seems to like Pop now. That's the benefit of being out for a while, maybe gone. I just hope you recognize what even I'm able to recognize, being spawned from the same wolf pack. I hope you are able to appreciate what you did in your state and what it means for the rest of the country now, and what it will always mean to those who love and care about you the most. I'm wowed by what you did, and more importantly, I'm wowed by how you did it. This was very hard. I know it's not over, but obviously I love you as a brother. Obviously I'll never be objective. Obviously I think you're the best politician in the country. But I hope you feel good about what you did for your people, because I know they appreciate it. Nothing's perfect. You'll have your critics.
Thank you.
But I've never seen anything like what you did, and that's why I'm so happy to have had you on the show. And I hope you know that.
Yeah. Look, we're not big on sweet talk, but
That was
what
pretty
Dad
sweet.
was all about was making a difference. That was sweet.
You made a
I
difference.
wonder who wrote it. What Dad was all about. Well, you just stole my line. What Dad was all about was making a difference. And he would say, who cares what they say, right? He lost his last election. People forget that. Who cares what they say? It's what you know. It's what you did is right. What I did here was right. And whatever, was a political no-win. As you said from day one, you have people on both sides, and you couldn't make anybody happy. So you just do what's right. I did what was right. I'm comfortable with what I did. I think the facts bear it out. I think the numbers bear it out. I think we saved tens of thousands of lives. But I did what was right. And you do what is right. You tell the truth. You get up every night, and you tell the truth, whether they like it or not. This is the truth the way you see it. And that's all you can do. So I hope he'd be proud of me. He talked to me a lot through this, by the way. 111 days. I did a briefing every day. I couldn't sleep at night. I'd close my eyes, and I would say, what would Pop say? And he spoke to me, and he helped me tremendously to get through it. But what you do is the same thing. You're doing the right thing, and that's all we can do. Love you. Go to work.
I love you very much. I appreciate you being on. I'll see you soon.
Thank you, brother.
Okay, so you obviously see the type of fawning over that is happening. Obviously, Andrew and Chris are brothers, and I don't fault Chris fawning over his brother. I can tell you, if I ever had my brother or my two sisters on whatever show I ended up having, obviously it'd be a different story. I wouldn't be interviewing them like they are a public official. I'd probably be talking to them like they were my brother or sister. So you can imagine that Chris Coleman using his airtime to essentially have a conversation with his brother, when he simply could just focus his time on actually getting down to the bottom of how public officials are handling or containing the spread of coronavirus, by interviewing someone he's not related to. You can see how this is obviously pretty gross, and it's been rightly called out. I haven't had, obviously, the time to address it myself, but I've always thought that if my brother, who's 3 years older than me, if he ever ran for office, we would joke that I would interview him, but we all know very well that that can never happen because of the conflict of interest of simply being related. And I'm surprised that this went on for so long, considering that we're now at the end of June, and he started having his brother on basically in the middle of March. And I don't recall if it was every night, but it certainly sounded like it was once a week. And I think it's a kind of a disservice to the people who are looking for leadership and are left with simply sibling banter. And look, I thought it was funny at first. I thought it was really funny that the two were actually dunking on each other live on air about, calling mom and like, I'm mom's favorite, and that you were basically a hooligan when you were growing up, and like I was the good kid. That's funny, but it's not worth the airtime after so long. It got old. And unfortunately, it was a joke that ran too stale, much like the list. I oftentimes think about the list and how long I could keep that going. And to be honest, I probably will retire that as soon as the election ends because it is my hope that people will calm down a bit and I can just get back to just my normal routine and not be beholden to the list and Twitter. Maybe I could take a break and I don't know, delete my account. I'm sure a lot of people would like that. Look, but despite the fact that New York seems to have their coronavirus number, their cases and their deaths under control, they're certainly below 1,000 per day. Other states are obviously having it worse. You're looking at Texas, you're looking at Florida, you're looking at Arizona, even California. If we look at California in particular, just today, the Los Angeles Times reported that the latest surge in coronavirus cases began around Memorial Day. And if you remember, this is around the time that businesses started reopening. People were getting together for day trips to the beach. They were going to, Memorial Day weekend barbecues and gatherings. You have Father's Day gatherings in June. But also, and I can't stress this enough, we had these massive protests in Los Angeles. We had it throughout the country, Minneapolis, New York, DC. No city was really, there were very few cities in which protests weren't happening. Houston is another place, I believe Miami, and these hot spots. And those protests in particular in California seem to have contributed probably in a large part to the surge that we're seeing in coronavirus. And despite the fact that people, probably a wide majority or a significant majority of protesters wearing masks, not everyone was careful. It's not like a mask can 100% stop anyone from getting coronavirus or contracting it. And it looks like people weren't social distancing enough, and they weren't taking the necessary precautions. I'm sure people were touching each other, shaking hands, hugging, what have you. Exchanging bottles of water, or even from say things like tear gas or just the humidity in the air, the water molecules in the air, contributing to the spread of coronavirus. And I'm worried we haven't seen the end of it. Cases are probably only going to continue to go up, deaths with it. Just on June 27th, the California Department of Health reported 4,000 coronavirus hospitalizations, more than 4,000 coronavirus hospitalizations, and just a little over 1,000 being in the ICU. And they haven't seen this type of hospitalization rate go up this fast since early April. Obviously disheartening. You kind of had to expect something like this would happen, given the fact that protests were happening widespread throughout the country. And while we may not have seen anything in New York, we've certainly seen things in California, in Texas, in Florida, and some of these states are now about to deal with the worst brunt of it, and just got to pray for them. Arizona is another state in which, say, they're having difficulties with contact tracing. And for those who aren't familiar with contact tracing, that's simply keeping track of an individual who tested positive for coronavirus, and then everybody they ever met with and talked to, or they got close to, say, family members, friends, coworkers, people at, say, restaurants, what have you. They could have exposed hundreds of people, creating another outbreak. And Arizona is having difficulty with contact tracing, and this is probably a microcosm of what's happening throughout the country. Is that it's really difficult to contact trace when you don't have enough people to staff to follow those people. That's an issue that Arizona's having. But also, people aren't cooperating. They're not answering the phone to contact tracers to basically check in, especially if they've tested positive for coronavirus. And the amount of days that are factored in. You're looking at anywhere between 2 to 5 days of someone getting tested, getting the results, and then realizing that in those 2 to 5 days, they have exposed, say, hundreds to maybe even thousands of people to coronavirus. And another interesting point about all this is that in the beginning of all of this, people over the age of 50 were the ones who are more likely to get diagnosed with coronavirus. Now it's people between the ages of 18 and 49, primarily under the age of 35. I'm 32. I haven't contracted coronavirus yet. It's possible I could have already had it and been asymptomatic. I don't know. I never got tested. But I've been basically hunkered down in my home, and the only times I've gone out, I've been to the store wearing a mask, and sometimes I've golfed with my dad and brother. So when it comes to coronavirus, just remain vigilant. And look, even Sean Hannity is saying to wear a mask, and we should probably do that. It would help if obviously there wasn't as much misinformation or disinformation out there. You're seeing a lot of pushback from people on both sides about who to trust, and it sounds like obviously the politicization of public health has happened, from public health officials essentially approving the protests on racism, saying that racism is a public health crisis, to say people basically saying that wearing a mask is like in defiance of God, or it's an act of devil worship. Like, we've seen it all. It's just it's really, I mean, essentially, you gotta laugh at some of this stuff. Just protect yourself, protect your family. That's all you gotta do.